So after a pregnancy that has been complicated by gestational diabetes, women do have an increased risk of developing type 2 diabetes in later life. And that risk may be as high as even 70% in the next 10 years. There are varying studies that have varying statistics. And first of all, understanding that, yes, the gestational diabetes might have gone away, but that it's a trigger, it's a thought that, right, okay, actually that there is the way that I'm made, it does increase my chance of type 2 diabetes, and therefore it's important to engage with your healthcare professionals going forward. And that is, in the UK, we suggest that they have an A1C every year, because again, type 2 diabetes is much more dangerous if it's not diagnosed than if it's diagnosed and treated. And that's what we're trying to get to. And then the second thing is, obviously there are things that we can do to try and minimize the transition to type 2 diabetes in terms of, again, healthy weight gain, or your health, maintaining a healthy weight, physical activity, those sort of things are very important. So, and then there's subsequent pregnancies, obviously, and there is an increased risk of gestational diabetes in subsequent pregnancies. And so I guess the journey isn't finished at the end of the pregnancy. There is a requirement, first of all, to make sure that the gestational diabetes has gone away. So testing after pregnancy is really important. And sometimes it gets missed when you've got a baby and you're tired and, all the rest of it. And those tests don't always get done, and they really should do for the optimal health. But then understanding that this maybe has an impact on future health and how we can best minimize that impact on future health is really important.